Hi, everyone. Thanks for watching our Medicare 101 video today. I'm Kate Urchick with Professional Planning Services. We're based in New Jersey. In addition to Medicare, we provide services related to health insurance and a variety of financial services, including investment and insurance solutions. What transitioning to Medicare means to us is that you're enrolling into the Medicare system either when you first turn age 65, also known as first eligible, or you're starting Medicare after age 65 due to retirement. You may be trying to figure out how to get your coverage figured out without making major mistakes. Of course, one of the biggest hurdles to overcome in this process is understanding the basics of the Medicare system. So during this video, I'll provide an overview to help you understand how Medicare works so that you can ultimately choose the best coverage that meets your individual needs. Just like individual health insurance, Medicare is not one size fits all, and finding the best coverage for you depends on your specific circumstances. If you're turning 65, you probably know what this slide means. You're likely seeing this every day in your mailbox, not to mention the endless stream of robocalls that you're likely getting. If you look here, these mailers are designed to look official and have you feel that this is the only way that you can get help with Medicare. We're here to help cut through that noise, to help you find out which plan is best suited for you. When it comes to your transition to Medicare, details do matter. We're an independent source of information regarding the changes you are going to face in order to avoid the pitfalls that exist in this system. That being said, let's get started. During this video, you're going to learn the ins and outs of Medicare. That means, what is Medicare? Do I need it? How much does it cost? How do I enroll? What will it cover? What do my healthcare choices look like? How do you put all the pieces together? And one of our goals is to get you through this process in a stress-free manner so that you can go and relax and get on with the more important things like enjoying your retirement. First, what is Medicare? We always tell people that if you think of Medicare just as another form of health insurance, it can make the whole process easier to understand. Yes, it's going to be different than what you're used to with employer coverage or even individual coverage, but at the end of the day, it's simply health insurance coverage that is administered by the federal government. Whenever anyone refers to original Medicare, they're only talking about Medicare Part A and Part B. We'll cover Parts A and Part B shortly, but understand here that original Medicare is not free, nor is it designed to cover 100% of your healthcare costs. Additionally, being a federal program, it's designed to primarily work inside the United States. We're going to cover three main scenarios that are most likely to apply to you. The first scenario is that you're enrolled in original Medicare Parts A and B as your primary insurance, and you have also enrolled in a Medigap plan to help cover the remaining out-of-pocket costs. In this situation, it is also likely that you have enrolled in separate Part D coverage to help cover prescription medications. The second scenario is that you are currently enrolled in a Medicare Advantage plan, which is also referred to as Part C. These plans typically include prescription drug coverage. Lastly, you are currently enrolled in only original Medicare, which is Part A and Part B, with or without Part D prescription coverage. And you do not have Medigap coverage. Part A, let's talk through what this coverage provides and what it costs. Most people will pay no premium for Part A coverage as long as you have satisfied the 40-quarter requirement related to Social Security and Medicare payroll taxes. As long as you've satisfied that requirement, you have essentially pre-funded your Part A premium, meaning you'll pay nothing for Part A. Note also that if you have not satisfied this requirement, you may also be eligible for premium-free Part A through a spouse's record. The majority of people do not pay additional Part A premiums. What does Part A actually cover? We typically refer to this as room and board coverage. It'll help cover hospitalization, skilled nursing facility stays, hospice care, and some home health services. There are deductibles and coinsurance requirements if you're hospitalized or receive inpatient services with another facility. However, remember that deductibles and coinsurance are only going to apply if you have only original Medicare for your coverage, as you'll see shortly. Most people will be choosing additional products that will alleviate these costs. One thing that we always want to point out is that Medicare will not be a provider of long-term care coverage. Many people tend to confuse the term skilled nursing with nursing home coverage, and they believe that Medicare will cover these items. Know that they will not, and you should work with your financial professional to discuss your long-term care strategy, as many people do require this coverage as they age. Professional Planning Services offers several solutions for long-term care, so give us a call if you have questions about that. Unlike Medicare Part A, Part B does come with a monthly premium that we'll highlight shortly. Medicare Part B is designed for outpatient medical procedures, such as doctor's visits, durable medical equipment, outpatient surgeries, and more. During 2021, the annual Part B deductible was $203. There's rumors that in 2022, the Part B deductible is going to be $217 for the calendar year. After you've met this deductible, you are responsible for 20% of the medical costs that original Medicare does not cover. It's important to note that there's no cap or max out of pocket to what that 20% could be in any calendar year. That's why it's important to pick up Medigap or Medicare Advantage coverage. Let's talk about some items that original Medicare will not cover, and we won't get into everything. We just mentioned long-term care coverage, but many people are surprised to learn that original Medicare will not cover routine dental, vision and hearing items. They will also not cover gym memberships, nor will they cover prescription medications. And remember, when we're talking about original Medicare, we are only referring to parts A and B. Let's jump right into a common Medicare myth. Many people think it's mandatory to enroll in Medicare Part A at age 65. Contrary to what your friends, family, or TV tell you, you aren't required to enroll in Part A at age 65, unless, of course, you are receiving Social Security benefits at 65. If you are drawing benefits at least 4 months before your 65th birthday, Medicare Part A will be mandatory, but for the rest of you, surprisingly, it is not. I'm pointing out that to show you how confusing figuring out what to do for Medicare can be. Many people believe that you have to enroll into Medicare at age 65 when you get notices like this from Social Security Administration. Take a look at the highlighted area. It says, quote, even if you don't plan to receive monthly benefits, be sure to sign up for Medicare 3 months before turning age 65. Well, the words following that statement are technically correct, but it can be extremely misleading for the consumer. For example, if you and your spouse are turning 65 and are actively working for a large employer with over 20 employees and plan to continue working past age 65, you do not technically need to enroll into Medicare Part B when you're first eligible. As long as your employer coverage is credible, you will not be penalized later. But the notice on Social Security states if you don't sign up when you're first eligible, your coverage may be delayed and you may pay a late enrollment penalty. You can see why it's hard to know what to do. And it's kind of scary because you don't want to pay that fee. These documents are very generalized, but people read them and can often make mistakes. We can help you walk through your individual situation. Be careful where you seek advice. Your friends, although they have the best intentions, are often as confused as you are, or their situation may be entirely different. The Social Security Administration is not always a reliable source for Medicare information. Social Security's role in this process is to facilitate enrollments and collect premiums for Medicare A and B. That's it. Your doctor has enough on their hands when it comes to medical care. They don't have time to be insurance experts, and outside advisors may also have limited knowledge when it comes to the Medicare system and your choice. If you work with us, a typical intro conversation with a person seeking Medicare help will be kind of like this. We'll first ask about your current situation. We'll ask questions like, are you actively employed? Are you working for an employer with less than 20 people? Are you possibly eligible for any retiree coverage? Are you currently enrolled in the ACA or marketplace coverage? Do you plan on using COBRA past age 65? All of these situations can uniquely impact what you should or should not do related to your Medicare coverage. Now let's assume that you've gone through this analysis and that your outcome is that you need Medicare. One of the first questions you'll have for us is, how much will Part B cost me? And you may be surprised to learn that Medicare Part B premiums are subject to something called IRMA, Income Related Monthly Adjusted Amount, which means it's directly correlated to your income. Your Part B premium is based on your modified adjusted gross income from your tax return 2 years prior to your enrollment in Part B. Most new Medicare enrollees will find that their premium for 2021 will be $148.50. I believe in 2022, it's going up by $10. It's not been officially announced at this point. So it would be closer to $158.50. Note that this is per person per month. Everything when it comes to Medicare is on an individual basis. If you're one of the people that are affected by these higher income surcharges shown here, it may be possible to request a redetermination to lower these premiums. Please give us a call to see if this may apply to you. Not only does your income impact what you may pay for Medicare Part B, but those same income thresholds will impact what you'll pay each month for Part D prescription drug coverage. So if we've determined that yes, you need Medicare, we've gone over what your particular costs will be for original Medicare. Now let's talk about how you actually enroll into Medicare's Part A and Part B. For Medicare Part A, there are a couple of special considerations that we're going to discuss here. One, if you're currently receiving Social Security benefits prior to turning age 65, you will be automatically enrolled into both Part A and Part B. We are only focusing on Part A here. So just note that if you're collecting your benefits, you must remain enrolled in Part A. We should point out a second scenario, which relates to Part A health savings account contributions. If you're enrolled in any part of Medicare, you are no longer eligible to contribute to an HSA, so you'll want to delay your enrollment into Part A or stop your HSA contributions. If you're not contributing to a health savings account, you will likely want to enroll in Part A when you're first eligible at age 65, even if you plan to continue working. Here's a good graphic showing when you should apply for Medicare Part A when you're first eligible. This can be done during your initial enrollment period. Many of you know this time period. You'll call us and say, I think I have to do something 3 months before my birthday. You're close. This time period consisting of the 3 months prior to your 65th birth month, the month of your birthday, and the 3 months following your birth month is called your own initial enrollment period. If you are not drawing Social Security benefits at least 4 months prior to age 65 and do want to enroll in Part A coverage, we recommend going online to ssa.gov during these 3 months prior to your birthday month to enroll. All right, so now let's look at the two main scenarios when to enroll in Part B Medicare coverage. Enrolling in Part B can be a little tricky. There are two general scenarios when it comes to enrolling in Part B. And the first scenario is you're applying for Medicare Part B at age 65 when you're first eligible. There are two situations that can occur here. You either are already claiming your Social Security benefits for at least 4 months before you turn 65, or you are not. First, let's look at what you need to do to enroll in Medicare if you're drawing Social Security benefits. You may remember that you will automatically be enrolled into Part A and B if you are collecting Social Security income benefits. If this is the case, you should expect your red, white, and blue Medicare card to arrive 1 to 3 months before your 65th birth month. If you want to be enrolled in Part B, you need to do nothing further. You will be enrolled into both parts. Now, let's say you don't want to be enrolled into Part B, but you're drawing Social Security benefits. Here's an example. Mrs. Smith is turning 65 and elected to receive her Social Security income payments at age 63. Mr. Smith is 63 years old and he is still working. She is currently covered by his employer insurance plan. Then her Medicare card arrives and she files it away, not realizing that she has enrolled into Part B, which she does not need. Remember, she has her health insurance through her husband's employer. Now the payments for Part B are still being automatically deducted each month from her Social Security benefits, and this can easily go on unnoticed. Therefore, if you are drawing Social Security benefits and you do not want Part B medical coverage, you'll need to follow the instructions that come with the Medicare welcome packet and your red, white, and blue Medicare card. Here's an example of the instructions that you'll receive. You'll need to follow these instructions all the way through. And then once you do so, you will receive a Medicare card indicating that you only have Part A hospital coverage. Now let's shift back to if you're not drawing Social Security benefits at least 4 months prior to 65, and you do not want to enroll in Part B. At age 65, you will need to be proactive and actually apply for this coverage during your enrollment period, which begins 3 months before your 65th birthday and ends 3 months after your 65th birthday. I can't stress this enough. This will not happen automatically. The best way to do this is to go online and enroll through ssa.gov. You can see here on the main page of their website, you'll go to the Medicare enrollment section, and this is where you can apply for Medicare Part A and Part B. Another way to enroll is to call Social Security directly at 1-800-772-1213, or you can go in person to your local Social Security office. If you decide that you're turning 65 and you do want to start Medicare Part A and Part B, you will want to enroll during your initial enrollment period. More specifically, during the 3 months before you turn age 65, so that your coverage will begin the first day of the month that you turn 65. Again, you do have the 3 months after your birthday to complete your enrollment as well, but that could leave you with a gap in coverage from your current plan into your Medicare transition. Let's take a look at the second scenario related to applying for Part B. This is when you deferred Part B when you were first eligible at age 65 because you had employer coverage. Now you're retiring at past age 65 and you need your Part B coverage to begin. This does require a different process than applying for Part B at age 65. You will need to show proof of credible insurance coverage through an employer so that you will not receive a late enrollment penalty. There are 2 forms that you'll need in order to complete the Part B enrollment process at this point. One is Form CMS L564, and the other is Form CMS 40B. On the screen, you'll see an example showing L564, which is the request for employment information. You'll have to get this form filled out by your employer's benefit department or whoever handles the insurance benefits at your employer. Form 40B, on the other hand, is your application for Part B coverage that you will also fill out. Your employer does not need to fill out anything when it comes to 40B. You'll notice here at the top, it's asking for your Medicare number. You're going to need to have your Medicare number in order to submit this form, meaning that you will need to have applied for Part A first. Now, this is very important, but on this form, be sure to note in the remarks section, which is section 12, the month you want your Part B to start. You want to specify exactly when you want your Part B to begin. Note that if you did not enroll into Medicare Part A when you were first eligible, you only need the employer verification form and not the application for Part B, which is this form 40B. Okay, so now that we talked about how and when to sign up original Medicare, Parts A and Part B, let's talk about what comes next. Once you have Medicare Part A and B in place, you'll want to decide which additional coverage path is the one for you to take. Here's the starting point. We do recommend that you take your 2 forms to the Social Security Administration's local office. And you can ask them to process those forms while you're standing there. It only takes them about 5 minutes, and we have heard of situations where forms were lost that were dropped off. You could also mail them into Social Security, but again, going down to Social Security, handing out them the forms and asking them to process is the most efficient way. Okay, so now that we've talked about how and when to sign up for original Medicare Parts A and Part B, let's talk about what comes next. Once you have Medicare Part A and B in place, you'll want to decide which additional coverage path is the one for you to take. So here's the starting point. You can see here from the official Medicare and You handbook that there are 2 main choices when it comes to rounding out your Medicare benefits. The first option, as you can see on the left, is that you can retain original Medicare as your primary insurance, and then you add to that supplemental coverage in the form of Medigap insurance, along with a standalone Part D prescription drug plan. On the right is your second option. You may choose to enroll in an all-in-one alternative to original Medicare, which is known as Medicare Advantage, and also sometimes referred to as Part C. Let's take a closer look at what these two options look like. This is an example of how Original Medicare works with Medigap insurance plan, plus Part D prescription drug plan for medical coverage. Original Medicare will remain your primary insurance. Then your Medigap plan will become your secondary coverage, designed to pay the out-of-pocket costs that we discussed in the beginning, left behind by Original Medicare. And you'll also need to add prescription drug coverage, also known as Part D, if this is the route you decide to take. Because Original Medicare remains your primary insurance, you may seek care at any physician's office or facility that accepts Original Medicare. Now we'll take a look at Medicare Advantage. Remember that this is also commonly referred to as Part C coverage of Medicare. Know that this is the all-in-one alternative to Original Medicare with Medicare Advantage. The federal government funds private insurance companies to administer your Medicare benefits. When this happens, you can see here that Part A, Part B, and your prescription drug coverage are built into one package because the Medicare Advantage plan is now your primary insurance. You must agree to seek care at doctors, facilities, and hospitals that are contracted with your specific Medicare Advantage plan. This chart helps put things into a real-world perspective using the 08873 New Jersey zip code. We're going to compare the two choices that you have when it comes to your Medicare coverage. You can either choose a Medigap plan or Medicare Advantage, as we mentioned. And let's start with the monthly premiums, which is the fixed amount that you'll pay to have your coverage in place. Note here that this monthly premium will be added to your Part B premiums each month. So to be clear, regardless of which path you choose here, you will still pay a monthly premium to the government for Part B coverage. The monthly premium for Medigap in this case is $150 per month. Now these plan costs do vary, but I just picked a popular plan, which is the Plan G from, a well-known carrier. This one was United Healthcare. I also chose a Medicare Advantage plan from United Healthcare to compare it to. The Medicare Advantage plan comes with no additional premium. Some plans do, but this particular one is $0. In our example, we're going to look at Medigap Plan G. So with a Medigap Plan G, when a person pays their $150 per month to the insurance carrier, the carrier pays all Medicare approved costs that Medicare does not cover. This Plan G comes with a $203 annual deductible in 2021. That's the Part B deductible, and which is estimated at this time to be $217 for 2022. And once you have met that deductible, you'll be fully covered for Medicare approved medical procedures for that year. Hence the many zeros you see for the out-of-pocket cost. Now let's take a look over the Medicare Advantage column. The lower, or in this case, non-existent monthly premium with a Medicare Advantage plan will come with a higher out-of-pocket costs when you do seek care. I won't review all of these in detail, but take a minute to look at some common procedures and the co-pays with these particular plans. Again, this is just one plan out of thousands of Medicare Advantage plans available in the United States. Be sure to look at the plans available in your area. Plans can vary from county to county and even zip code to zip code for Medicare Advantage. Lastly, you'll notice that routine dental and vision care is included in many Medicare Advantage plans, which is one of the many features that differentiates them from Medigap policies. Now, what many people begin thinking about when they're running through the last example is, I'm pretty healthy. I take minor cholesterol medication. I like the idea of having some dental built into the plan. So I'm going to go with Medicare Advantage for a few years, and I'm going to see how it goes. Well, that might work out or it might not. Let's talk about why your health, not only now, but in the future, is really important to discuss and think through. You can see here on the official Medicare and You handbook, it's noted that the best time to buy a Medigap policy is during your Medigap open enrollment period. What this means is that you have a period of 6 months that begins the first day of the month that you are both age 65 or older and have started your Part B coverage. What this means in reality is that you can purchase any Medigap policy regardless of any pre-existing conditions during this time. So if you didn't know this piece of information and you had already enrolled in a Medicare Advantage plan, and then 4 years later, for example, you develop certain pre-existing conditions, and now you want to secure a Medigap policy to keep your costs down, you may be declined for that coverage. You could also be accepted into the coverage and have to pay a much higher premium. That's why it's important to understand your Medigap enrollment period, regardless of your current health. Here's the graphic that shows your Medigap open enrollment. Again, you notice that you must be over age 65 and have your Part B newly activated. This enrollment time is not to be confused with the annual election period that occurs from October 15th until December 7th every year, and is often mistakenly referred to as open enrollment. Medigap open enrollment is specific to you, the individual, and it does not occur again once it has passed. I recently saw an ad that said you can change plans as your situation changes, but only during specific times such as October 15th to December 7th. Well, it's not that cut and dry when it relates to pre-existing conditions, which is why we really caution you to understand exactly how these open enrollment periods can work and how they can greatly affect your plan choices. Okay, so here's an overview of some of the highlights between Medigap and Medicare Advantage. As you can see here on the left, Medigap allows you to have your choice of physician or hospital anywhere in the country, as long as they accept original Medicare. This allows you to travel within the United States without having to worry as much about finding in-network care. So say you live in New Jersey, you have a house in Florida, and you spend 6 months there, 6 months here, Medigap is probably the best choice for you. Budgeting is also easier with a Medigap plan, although the monthly premiums are higher. You don't have as many out-of-pocket expenses, so you have more flat costs throughout the year. Part of the out-of-pocket cost that is super important to note is that there are lower medical costs should you need more treatment. If you have cancer, if you have heart attacks, or more severe needs, your out-of-pocket costs are not going to increase with Medigap plan. These plans also provide flexibility, whether it's traveling or it's picking a drug plan that fits well with your Medigap plan. Now, the one thing with Medigap plans is you do have to acknowledge that they are higher premium, and you have to be okay with that if you choose a Medigap coverage. As you saw on the last slide, Medigap plans can be anywhere from around $150, whereas Medicare Advantage plans are much lower premium. Now on the right-hand side, let's talk about Medicare Advantage, which again, we do recommend these all the time for anyone who cannot afford Medigap premiums. This is by far better than having nothing when it comes to original Medicare. These are also great options for anyone under 65 that may have Social Security disability, because if this applies to you, you'll find that Medigap premiums are often much higher than they are for people 65 or older. If you get most of your medical care through the VA system, Medicare Advantage plans can be a great low-cost option should you seek care outside of the system. Also, some people are just fine with networks and they don't mind having restrictions of having to find in-network facilities where they accept your Medicare Advantage plans. Others may even think, I'm healthy, and that's not going to change. We're not here to convince you otherwise, so we can help you find a Medicare Advantage plan that works for you. Lastly, not everyone travels as much during retirement. If that applies to you, you may be okay with a more limited local network that is going to reduce your monthly premium. I also want to finish this recap by mentioning again that Medigap plans don't include any additional benefits like gym memberships, dental, vision, and hearing coverage, or over-the-counter benefits in their coverage. Whereas on the other hand, Medicare Advantage plans do typically include routine coverage for dental, vision, hearing, as well as potentially a free gym membership and some other additional benefits. Now let's talk about prescription drug coverage and how it relates to Medicare Advantage and Medigap. If you have original Medicare and Medigap, you should purchase a standalone prescription drug plan, also known as Part D. What this looks like is that you have primary medical insurance through Medicare, secondary insurance through your Medigap plan, and then separate standalone prescription drug coverage that you will use when you need to go through to the pharmacy to get your prescriptions filled. Whereas with a Medicare Advantage plan, your prescription drug coverage would be part of the bundled package that we mentioned earlier. That includes your medical coverage. Of course, we can't talk about prescription drug coverage without mentioning the infamous donut hole. We have another video that goes into detail on this topic if you visit our YouTube page. So if you really want to understand how the donut hole works, that's going to be your best bet for now. Just understand that if you do take expensive medications, once you're in the donut hole, it will likely result in higher costs associated with your prescriptions. Once you've gone through deciding that Medicare is right for you and you understand how much it costs, you now are enrolled into Part A and B, and you've decided which path to take for your coverage, what happens next? How do you put it all together? That's where we come in. We can help you review your coverage options, including both Medigap and Medicare Advantage. We can help you narrow it down to what carrier is best for you, how much that will cost you each month, and enroll you into the best drug plan for your particular medications. We handle all the paperwork, and we try to alleviate the stress of you going through this process alone. This service comes at no additional cost to you, as we're compensated by insurance carriers, just as your home and auto insurance agents are. In addition to helping you get enrolled into the system for the first time, we're going to continue to be there to assist you reviewing your plan annually. Typically, the time for this review is during the annual election period, known as AEP. The annual election period is the yearly time when individuals who are already enrolled into Medicare can make changes in their Medicare coverage. If you're trying to enroll in Medicare Part A and B for the first time, this is not a time period you have to wait for. The annual election period begins on October 15th and ends on midnight of December 7th. If you make a change during this time period, your new coverage will be effective on January 1st of the upcoming year. It's important to know what you can and can't do during AEP. The annual election period is not open enrollment. There are some restrictions to what you can and can't do. Also, you may not want to do anything during this time period, and that is totally okay. Just take time to check to see if your coverage is changing and if you're comfortable with the changes being made. Lastly, like always, if you have any questions about your Medicare coverage, be sure to give us a call. We're independent insurance brokers, and we can help you compare plans on the market. What many people don't understand is the timing related to when they can change Medigap plans. So this example is going to be if you're trying to go from one Medigap plan to another. You can do that during the annual election period, of course, as we mentioned. However, you should also know that you can change every single day of the calendar year. We want to emphasize that because so many people think that they have to wait until the fall to change their Medigap plan, when in reality, they can work on changing plans anytime during the calendar year. So if you get a rate increase in February or March or April, don't think you have to wait until October to make a change. You can start saving money right away. Again, this does come with the caveat that you have to pass underwriting in order to change plans. If you have questions or want to learn more about Medicare and how it relates to your particular situation, please give us a call. You can reach us at 732-302-1810. And thanks again for joining us for this Medicare video. We look forward to working with you.